In this lecture, we'll discuss about artificial kidney, the indications and the principles of hemodialysis, filters, types, different types of hemodialysis, monitoring systems, and finally, wearable artificial kidney. Introduction of urinary system. A urinary system is also called as renal system, is responsible for removing waste and excess fluid from the body. The main organs of urinary systems are kidney, ureter, urinary bladder, and urethra. The kidney. These are the primary excretory organs that filter waste and excess fluid from the body. They remove the nitrogenous waste such as urea, regulates electrolyte levels. Ureter. These are the narrow tubes that connects the kidney to the urinary bladder. They also transport the urine from the kidney to the bladder. Next, urinary bladder. This is a muscular sac that stores urine until it's eliminated from the body. Urethra. It's a tube that carries urine from the bladder out of the body. The kidney plays a crucial role in maintaining overall health by regulating fluid balance, removing waste such as urea and creatine, maintain electrolyte balance, regulate blood pressure, and also produces hormones. Next, ammonia and urea are the chief nitrogenous waste which is produced during this metabolism. Both urea and ammonia are taken to the kidney by the bloodstream, and the kidney excrete urea and ammonia in the urine along with the uric acids, salts, and the water. Description of the kidney. The kidney are dark red in color. It's a bean shaped and it's a paired structure, which means one on each side of the body. It is located in the lumbar region on either side of the median vertebral column. Approximately 11 centimeter in length, 6 centimeter in breadth, and 3 centimeter in thickness. The weight of an adult human kidney is approximately 120 to 170 grams with an average weight of around 150 grams. Approximately, it's the size of a clenched fist. A kidney are indeed a vital organ that plays a crucial role in our overall health, and their unique shape and the structure allow them to perform their functional efficiently. The right kidney is slightly lower than the left. This is because the right side of the abdominal cavity is occupied by the liver. Each kidney of the human is covered by a tough transparent membrane that is a fibrous capsule. The outer surface of the kidney is convex while the inner surface is concave. Next, we move on to the indications and the principles of hemodialysis. A hemodialysis is a procedure where dialysis machine and a special filter called as artificial kidney or a dialysis are used to clean the blood. A human dialysis is a medical procedure that uses a dialysis machine and a special filter. This removes the waste products such as excess fluid, electrolyte from the blood. This process helps to remove the urea and other waste products that builds up in the blood due to the kidney failure. And apart from this, this also restores the balance of the electrolytes such as potassium, sodium, and calcium, and also removes excess fluid and controls blood pressure. A hemodialysis is a life-saving treatment for an individual with an end-stage renal disease or acute kidney injury who requires a renal replacement therapy. It is usually performed in a dialysis center or a hospital, but can also be done at the home with the proper training and equipment. Principles of hemodialysis. A dialysis is a technique of removing toxic substance in the blood from a machine when the kidney are unable to perform their excretory functions. This dialysis machine is also called as artificial kidney, which is used for this purpose. So the main principle of hemodialysis is the blood from the artery of an arm of the patient is passed to the dialysis machine and also removes the urea and excess salt, and the blood is then passed back to the patient's body through the vein. So this is the principle of the hemodialysis. So apart from this, this also replaces the excretory function of the kidney of the overall concentration of solute in the urine to meet the needs of the body. The main purpose of this, it's not alone removing the waste products, but also the function of the kidney is to maintain the fluid, body fluid, electrolyte balance, acid base balance, and also to regulate the kidney functions. Next, the main phenomenon that take places in the dialysis are diffusion and ultrafiltration. A diffusion is a process by which a molecule from an high area of higher concentration to an area of lower concentration. In dialysis, diffusion occurs across the semi-permeable membrane of dialyzer, allowing the waste products, excess fluids and electrolyte to be removed from the blood. The figure shows the diffusion process. This is the dialysis membrane where the particles of blood cells are being separated from the dialysis fluid. Diffusion is a critical process that enables the dialysis to effectively remove the waste products and excess fluid from the blood, helping to maintain the overall health and well-being of an individual with the kidney failure. Next step is ultrafiltration. The ultrafiltration is also a membrane filtration process that uses semi-permeable membrane to separate the particles and macromolecules from a fluid, which is based on the size and the molecular weight. In the context of dialysis, ultrafiltration also refers to the removal of excess fluid and smaller molecules from the blood using a membrane with a pores smaller than the which are used in the hemodialysis. Next, we move on to the types of dialysis. Dialysis is a procedure that helps your blood get filtered by a machine which works like an artificial kidney. Based on the differences in the techniques, there are two types of dialysis. The first one is hemodialysis, as we have already seen the principle of hemodialysis. The second one is peritoneal dialysis. We'll see one by one in detail. Hemodialysis. As hemodialysis already mentioned, it's a procedure where a dialysis machine and a special filter, which is called as an artificial kidney or a dialyzer, are used for cleaning your blood. To get your blood into the dialyzer, the doctor needs to make an access or an entrance into a blood vessel. This is done by a minor surgery, usually from your arms. The term dialysis generally refers to the hemodialysis, and there is no difference between the two terminologies. Next is peritoneal dialysis. Unlike hemodialysis, which cleans the blood outside your body, this peritoneal dialysis helps to filter the blood in the body itself. So the dialysis is done in the body itself. This is done by allowing the cleansing the fluid to flow into the abdomen via a tube. If you see in the figure, you can understand how it is done in the abdomen itself. So the lining of the abdomen extracts the waste from the blood, and then the fluid along with the waste is drained out of the body. So this figure deeply explains about the pictorial representation of how a peritoneal dialysis is done inside the body in the abdomen. Next, we move on to the function of the artificial kidney. There are many functions of the artificial kidneys. This temporarily replaces the function of the kidney. The second one is the patient receives the blood from a plastic tube. The diastylate is an electrolyte solution which is suitable composition, and the dialysis take places across a membrane of a cellophane. Next is it returns the dialysis blood is done by the another plastic tube, and it is given to the appropriate vein. And this dialysis membrane is having a perfection which is extremely very small and even invisible through the naked eye. The waste products in the blood are able to pass through these minute perfections into the diastylate fluid, where it can be washed immediately. These perfections of dialysis membrane have an average diameter of 50 Armstrong unit, which is estimated from the range of 30 to 90 Armstrong unit. The waste products passes through the membrane because of the existence of concentration gradient across the membrane. The diastylate fluid is free of waste products molecules, and therefore those in the blood couldn't tend to distribute themselves evenly throughout the blood and the diastylate. This movement of waste product molecules from the blood to diastylate results in the cleaning of blood. So this is how it is done in the artificial kidney. So as we know about the ultrafiltration, which you have already seen, so the degree of ultrafiltration depends upon both on the pressure difference between the membranes and also the ultrafiltration characteristics of a membrane. An artificial kidney is simply a membrane separation device that serves as a mass exchanger during the clinical uses. So the only use of the artificial kidney is replacing the renal function. Therefore, it transfers the poisonous substance from the blood to the diastylate so that they might be eliminated from the body. Next, how do you know we need to do the hemodialysis? So what we'll see about the indications of hemodialysis. The indicators are the suggestions that is done for the kidney which is not properly functioning to maintain the normal body internal environment. The first one is, some of the indications includes, the first is decreased glomerular filtration rate. We call it as GFR rate. A low GFR rate means your kidney is not filtering the blood properly. So generally it is, if the GFR is 60, it means that you have a kidney disease. And if the GFR rate is too low, less than 15, then it means that the kidney has been failed and it needs a kidney transplantation. The second indication is symptoms of uremia. Uremia is a buildup of waste products in your blood that occurs as a result of untreated kidney failure. The patients with uremia may present with various symptoms which includes nausea, vomiting, fatigue, weight loss, chest pain, muscle cramps, restless legs, easy bleeding, and mental status changes. So these are the symptoms of uremia. Next is fluid overload. The fluid overload happens when there is too much of fluid in your body. It can raise the blood pressure, causes swelling, and also impact your organ functions. The next indication of hemodialysis is hyperkalemia. Hyperkalemia is defined as a serum or plasma potassium level above the upper limits of the normal, usually greater than 5 millimoles per liter to 5.5 millimoles per liter. While the mild hyperkalemia is asymptomatic, the high potassium level may cause life-threatening cardiac problems, muscle weakness, and also it may lead to paralysis. Next indication is acid-base imbalance. So acid is acidosis. The blood has too much of acids resulting in decreasing of blood pH, or alkalosis is the blood has too much of base resulting in increase in the pH value. Next one is uncontrolled hypertension. Uncontrolled hypertension can lead to complications which includes heart attack or a stroke, hardening and thickening of the arteries due to the high blood pressure, or the other factors can also lead to the heart attack or stroke or other complications. Next is pericarditis. Is an inflammation of pericardium, which is a thin two-layered fluid sac which covers the outer layer of the heart. Last indication of hemodialysis is, we call it as kidney failure end stage renal disease, or ESRD in short. So this is the final stage, that is, it is the last stage the stage we number it as fifth stage of chronic kidney disease. ESRD is also called as kidney failure, which develops when the treatment of chronic kidney disease is either delayed or not treated at all. So with GFR rate which is dropping below 15 millimoles per minute, the kidney function progressively get worsens. So these are the indications of hemodialysis. So the last topic is wearable artificial kidney. Wearable artificial kidney is a portable, compact device designed to filter the waste products from the blood and does the function of the natural kidney. It's a cutting-edge technology aimed at improving the quality of life for an individual with end-stage renal disease or acute kidney injury. Some of the features of this is it is portable. Since it is a small in size, it is lightweighted. It allows the patients to move freely while receiving their treatment. And continuous therapy. It produces a continuous renal replacement therapy, closely doing the natural kidney function. And it has increased freedom. It enables the patients to go to the treatment outside too. And the improved quality of life offers a great flexibility, allowing the patients to work, travel, and engage in activities while receiving their treatment. And this device can be used 24/7. So WAK is still an emerging technology with ongoing research and clinical trials aimed at refining its design, safety, and efficacy. However, it holds a great promise for the revolutionary renal replacement therapy and also enhance the lives of the individual with kidney disease. Thank you so much for listening to our lecture. Thank you.